Hi, Renato.
Hi, Sergey. Nice to meet you
Yeah,
again.
hi. Very glad to see you again, too. We know that there is only one session left of Group 9 of the Faith Schools in Istanbul. And it'll be in November of this year, quite far away from now. And it is dedicated to orthognathic surgery, or to
Yes,
be more precise, to joint orthodontic and surgical treatment, correct?
that's correct. That's correct. It's a great opportunity, and I hope to see lots of friends, especially from Russia.
Okay. And for those who want to save the dates, the session will be on the 20th, 21st, and 22nd of November. Yeah.
That's correct.
And your longtime friend and colleague, maxillofacial surgeon Dr. Mirko Raffaini, will be your co-speaker. And I guess it's quite a rare occasion when you lecture together. Am I right?
Yes, very much so. Mirko doesn't like to travel that much. He is always very busy, but he made an exception. So I'm so glad to be able to come with him because that would be a fantastic session. Because especially when you talk about orthognathic surgery and orthodontics, well, you need the surgeon, and he is the surgeon.
I'm absolutely sure. Okay, but I hear from many doctors on a permanent basis that surgery is always kind of a sensitive topic at consultations because most patients are, I would say, quite naturally afraid of it. So, do you agree that it is so?
Of course, yes, especially the parents of our patients. And therefore, we need to be very cautious in suggesting surgery. But we don't recommend surgery because we prefer surgery, because sometimes the discrepancies are so big that a heroic treatment oftentimes becomes a failure. And so that is the reason why probably about 50% of the cases that we treat surgically are retreatments, either treated once, twice, three times. So we have to be careful, and sometimes surgery is a very powerful tool that we should use.
Yeah. And as I've seen before, many of those who opt for surgical treatment, they get really fantastic results, as you show in your presentations, and I've seen quite many. So it can also be a mighty tool for changing people's lives, not just their dentition, and their lives in general for the better. Do you agree?
Yeah, absolutely, yes. Because, of course, respecting the legitimate request of the patient, we can propose options of treatment that can really improve not only their occlusion, but also their face, their psychosocial environment, and therefore we can improve what is called oral health related quality of life. And that is certainly something that is well demonstrated in the literature, but we experience that every day.
Okay. You have, I guess, more than 30 years of experience with surgery, and it has always been an option that you had in mind. The relevance of surgery, has it changed over those past 30 years?
Well, yes, for sure. Of course, my attitudes were basically influenced by Larry Andrews, Roth, Bill Arnett. So names that have been always considered surgery as a legitimate option to be used starting 30 years back. Nowadays, I would say that surgery, especially when we talk about orthofacial surgery that we are going to explain during the next session, is actually much more complex, meaning that it's not just orthognathic surgery. It's orthognathic surgery, it's plastic surgery, it's cosmetic surgery, along with aesthetic dentistry. So I think we have very many tools that we can use to provide the patient an attractive and natural looking result, something that especially young patients are asking us. And that's the reason why, as you said before, we can really change their quality of life.
And as you mentioned, the three parts, it's orthognathic surgery, plastic surgery, and cosmetic surgery. Does it mean that in the beginning, probably they were more concentrated on orthognathic surgery, whereas now you have to look at the whole package?
Well, yes, I think if we want to get the best possible result for our patient within the same operation, Professor Raffaini will show how to make improvement that are encompassing all the different disciplines that we discussed. And it's actually something that you need to treat as a team, and digital planning in that respect is extremely important to define who does what and when. So the patient is efficiently treated to the best possible outcome.
Okay. Another question that actually is very interesting. Many say that the advent, I think you said it once too, the advent of TADs allowed orthodontists to make movements that had been before listicle extremely difficult. And I know that you have strong statistics in your office. And have TADs in any way influenced the number of your surgical cases? Has they reduced?
Yeah, it's a quite, I'd say, interesting and complex question. I have to tell you the truth. It would take about an hour to give you a proper answer to it. But let's be very straightforward. I think TADs really are expanding the borders of what we can accomplish orthodontically. That's for sure. So, of course, that changed certainly our strategy of treatment in class 3 cases, in certain class 2s, in open bite situation. But having said so, TADs are just a tool. And then you can use this tool to do very efficiently the wrong thing. So we have to be very, very careful. TADS needs a proper upstream planning before we think about the downstream delivery of what we have planned. So it is, of course, a great opportunity, a great risk is if improperly used.
Mhm. I see. So it's both like it can be used for good and for bad.
Sure. And also, they are now routinely used. We use them continuously to prepare cases for surgery as well. So the reciprocal movement that they allow is a big opportunity in many different fields. So that, of course, something that we routinely use every day in orthodontic cases as well
Yeah.
in surgical cases.
Am I correct to understand they kind of add up to what you can do surgically and can make your orthodontic resurgical treatment more efficient and maybe take less time?
Yeah, of course, in certain situations, the type of movement that we can produce without the same amount of cooperation that was needed before, it's a big advantage. There is no question about that. But as I said before, they are just a tool. If you think that a tool can be used like a magic wand, well, you might be mistaken.
I see. I see. And I've seen many of your presentations, and it's actually one of my favorite parts is when I see the before and after pictures. In my view, they're absolutely amazing. So can you show just an example or maybe two? I don't know.
Yeah, well, we can make some very brief examples. Of course, what we are trying to accomplish when we treat a case is not just to see what it takes to get this class 2 treatment resolved. It's actually a specific evaluation of the different component of the face. So if you see that there is a class 2, but there is a big nose, a big chin, a biretrusive maxilla. So in this type of situation, you need to specifically decompensate the case so that Professor Raffaini can do then a double jaw surgical procedure to achieve the best possible result long term. So those are small changes, but they are very important changes where, as you see, Mirko was using not only orthognathic plastic surgery to have a good result, attractive, natural, without any stigma of surgery, with the proper class 1 and long term, with the result that the patient was actually expecting from us.
I'm always impressed, honestly.
Yeah, I think this is actually what a patient is asking us. So we are not forcing a patient into orthognathic surgery. We are simply saying,
Mhm.
look, within the context of your situation, the elective treatment that we can provide, elective means that is discretional, is not related to a pathology, but now the patient want to participate in defining the goals of treatment, what to be achieved, And I think that is something that we need to respect and requires a very precise, informed consent. So we are not cutting corners when we do surgery. We want to make sure that we are doing the best
I
of what
see.
the patient is desiring.
Okay. So all the phase courses, they are considered to be mainly for orthodontists. But the coming session will provide information for both orthodontists and surgeons. So it has always been advised to invite your surgeon to come over with the orthodontist, but probably not as many as they should come. From your perspective, why would you like to see surgeons in the lecture room? What is there for them?
Well, I think the way I experienced the last 30 years of orthodontics can go in two ways. One way is oversimplification, alignment of teeth that almost everybody can do. But now there is also a more specialistic approach that is looking in the broad area of interdisciplinary treatment where we use the know-how of different disciplines, not just restorative, prosto, implants, perio, but certainly also surgery. So when you want to get into this type of orthodontic specialty, then you need to form a team and you need to basically put together all the know-how that everybody can contribute. So I think it's not essential, is actually what is best for our profession.
Okay, and talking about the future of your profession, how do you see the future of orthosurgical treatment? Because now there are different views, like different ideas about how this branch of medicine should develop. What's your take on that?
Say that, of course, you will have the necessity of producing results that are not fulfilling only the necessity of getting to a class one. You need to get, of course, proper stable and functional occlusion within the context of the proper face that will tend to emphasize all the specific qualities that are present. Our patient doesn't want to get into such a complex treatment to get a class one. They want really to improve. That is the majority, I would say, of the cases, especially young patients. And I think that's exactly what we want to provide them. And if you want to achieve the same result only with orthodontics, with TADs or any type of tools, well, camouflage will never match the same result.
So I would say your message to young doctors who are just at the very start of their careers, you would recommend to pay attention and to consider this option, wouldn't
Well,
you?
of course, it has been always my passion, by the way. But I think if I have to give one unrequested suggestion to a young colleague, uh, start building up your team from the real beginning. That would be a great, great investment for your future.
Yeah. And in November, you'll share a lot more information.
Yeah, of course. I'm looking forward to that. And Sergey, I thank you very much for your time. And it's always a pleasure to talk to you.
Yeah. Same here. Thank you very much. It was really a pleasure to see you again. Well, see you in person in November in Istanbul.
Yeah, for sure. It's going to be a great pleasure.
Okay. Thank you.
Bye then.
Bye.